Remember to subscribe and hit the bell icon to never miss an update from iMumz.
Hi mommies, I know miscarriage is a devastating experience that can also lead to a lot of anxiety. Women who have miscarried are usually worried about their subsequent pregnancies. Can I conceive again? Do I need treatment for infertility? Are some of the common questions that are actually going on in the mind. While it is not regularly discussed, miscarriage is more common than we actually think. And it's likely that after an early onset of pregnancy loss, a woman will go on to have a happy, healthy child. I, Dr. Anita Chaudhary from the holy city of Kashi, will tell you how to plan your pregnancy after a miscarriage. Though getting pregnant after a miscarriage is no different from how you usually conceive, the below tips will actually help you improve your chances of having a healthy pregnancy. Understanding the odds. Many women who have miscarried once fear that they will lose their later pregnancies too. But a single miscarriage does not mean that a woman cannot carry a pregnancy full term. So it is just that fear. Usually an early pregnancy loss is caused by conditions like chromosomal abnormalities that don't depend entirely on the woman's reproductive health. Only about 1% of women have recurrent or more than 2 back-to-back miscarriages. Nearly 20% of all pregnancies result in a miscarriage, and this includes women who have already experienced a loss too. After 2 losses, the chances of miscarriage increase to 28%. But that still leaves a probability of 72% for women to carry a healthy pregnancy. And 72% is so positive. Understanding these odds can reduce your anxiety and ease your mind while trying to conceive again. So don't lose hope. There is always a way. 1. Take some time. Miscarriages can be exhausting both physically and mentally. After the loss, you require plenty of rest and self-care. While your body returns to normal in a few months after the loss, you should still take some time before trying to conceive. 2. Physically. We recommend at least waiting for up to 3 months after a loss so that your menstrual cycle becomes normal. You might start ovulating as early as 2 weeks after a miscarriage, but your body takes 2 to 3 months to have regular periods. Sometimes the HCG hormone can also take 1 or 2 months to drop back to the normal levels. If you try conceiving before that, you may get a false positive pregnancy test. And sometimes this steady drop in HCG can be misdiagnosed as another pregnancy loss. Some miscarriages need medical or surgical assistance such as suction and evacuation or dilatation and curettage. If you have undergone a miscarriage treatment, your body takes more time to recover and you are advised to wait longer before you attempt conceiving again. 3. Emotionally. No matter when it happens, miscarriage drains the couple emotionally. Intense feelings of grief, anger, and even guilt are very common. But there is no normal way to react to a loss of an unborn baby. Some miscarriages happen in a matter of a few hours, while others might take even days or a few weeks. Naturally, there are high taxing phases and people may take many months to recover from them. It depends on what kind of emotional support you have. Even though you want a child, don't rush into conceiving before you are mentally prepared. There is no set time to emotionally recover from miscarriage as it is a very delicate situation. And being free of stress and negative emotions will have a better impact on your next pregnancy. So it depends completely on you how well you can balance yourself and how soon you can balance yourself and you're prepared for the next pregnancy. 4. Detect the underlying causes. If you've had more than one miscarriage, getting a complete pre-conception checkup helps detect any underlying cause for the loss. There could be uncontrolled diabetes, thyroid problems, PCOS, autoimmune conditions, genetic abnormalities, and other health conditions which can cause miscarriage. By detecting them early, you have a better chance of conceiving and giving birth to a healthy child. If some health conditions prevent you from getting pregnant naturally, you can also opt for IVF. 5. Adopt a healthy lifestyle. Lifestyle changes are important to have a healthy pregnancy. A balanced diet that includes leafy vegetables, pulses, fruits, and iron-rich food supplies are very, very important for you. Along with it, drink at least 8 glasses of water every day. And if you smoke or you take some drugs, please, you must stop that, and even ask your partner to stop that, because indirect smoking will also impact the pregnancy. Avoid these habits and limit your caffeine intake also to less than 200 milligrams per day. Include mild to moderate exercises in your routine. Walking, jogging are simple things, and yoga is so easy to do. It is best to avoid anything too vigorous or strenuous, because extreme exercise can again inhibit your ability to release eggs. So it prevents ovulation. Try to keep stress in check by including activities like meditation and maintaining a journal. Remember to take folic acid supplements, as this prevents certain types of congenital abnormalities in the baby. Folic acid should ideally be started at least 3 months before you actually plan your pregnancy. 6. Keep your health in check. Discuss with your doctor beforehand. Depending on your medical history, they may prescribe some medications that can improve your chances of conception. If you have had multiple miscarriages, then they might also suggest some tests to understand the causes. Because once the doctor knows the causes and they give you the right kind of treatment, it will become very easy for you to conceive and have a full-term baby. Simple way of conceiving at home, you can use ovulation predictors. Timing your intercourse close to ovulation gives you a better chance to get pregnant. Using ovulation predictor kits, you can predict when you are going to ovulate. Though it is best to use the kits only after you start menstruating regularly post miscarriage. Even though you ovulate before that, the varying hormones in your body cause complications during conception and pregnancy. And your stress does play a very important role in the ovulation. So it is very important for you to remain stress-free and happy. And get into the habit of having regular sexual intercourse about 2 to 3 times a week. That gives you an equally good exposure to the chance of getting pregnant while keeping it natural and stress-free. Enjoy the bond with your partner and just think of good times, and that way you'll be able to conceive and have a healthy, happy pregnancy. Thank you and namaste.